So what are the indications for ultrasound? Well, there are quite a few. So first of all, ultrasound can be used to take a closer look at something that was found on mammography. And in fact, ultrasounds are often used to better characterize a finding on mammogram that made the study BI-RADS 0 or incomplete. And we discussed BI-RADS categories in the video from last week, November 1st, 2020. So feel free to review that video for a refresher. But anyway, so in BI-RADS 0 findings of mammography, an ultrasound will help to improve the characterization of the lesion that's being reviewed. Ultrasound can also be used to look at a lump that is felt but is not seen on mammography. So there are times where a patient may feel a lump in the breast, but then they're told that their mammogram is normal. And that doesn't always sit well with the patient, and I agree, it really shouldn't. So at that point, we can then do an ultrasound to review the area. Not that long ago, when a woman felt a lump, but it was not seen in mammography and couldn't be further evaluated, that woman would be swept off to surgery to remove the lump just in case it was a cancer. We were very aggressive with the surgeries that we were doing. And we've really learned so much. And now ultrasound can really be used to take a good look instead of rushing to surgery. Sometimes the lump will simply be bunched up dense tissue, and that's completely normal. And that can absolutely be identified on ultrasound and can give the patient a lot of comfort in realizing that this is completely normal. In fact, if I personally am doing an ultrasound, and if that's the case, I will actually turn the ultrasound screen towards the patient to show her what's going on, because I'm a big visual learner, and so I feel that it's really helpful to see what I see for the patient. Now, other times it will be a solid mass, and that may need further analysis, for instance, a biopsy. And then there are other times that it will be a cystic mass, and we'll talk more about cysts in just a few moments. Now, another indication is in women younger than 30. Ultrasound can be used to evaluate a lump. So in young patients, the breasts are so dense that mammography is really not very helpful. And in these cases, we'll get an ultrasound to get a good look at a specific spot. So you may hear that your doctor is ordering what's called a targeted ultrasound, and that's exactly what it is. It's targeted to the area in question. Ultrasound can also be used to guide minimally invasive procedures. And this is really nice because they're in real time with the patient very comfortable laying on their back with minimal patient downtime, minimal discomfort with the procedure. And we can do these really quick, minimally invasive biopsies to get a definitive diagnosis of a mass that we see on ultrasound. So we can take a few pieces, send it off to the pathologist, and really take a good look. Under ultrasound guidance, the minimally invasive procedure can be a fine needle aspiration. It can also be a core biopsy or a vacuum-assisted core biopsy. And in the operating room, ultrasound guidance can also be used for localization of a lump, whether it's palpable or not, that needs to come out. So after the way that I do this, at least, is after the patient is asleep, I scan the breast, I find the area of my concern, and I put in a guide wire or a needle so that I know exactly where that lump is, so that there's no question that the correct area is being removed. Now, ultrasound can also be used to guide cryoablation, and cryoablation is freezing of a mass to kill the cells. This was approved in 2002 for treating fibroadenomas, which are benign breast lesions. And we are hopeful, this is super exciting, that we're still on track to get FDA approval in 2021, so next year, for breast cancer treatment with this minimally invasive modality. Now, of course, this is in select breast cancer patients. Not everybody would be eligible, but those that would be, it's super exciting because it obviates the need for having surgery. Now, ultrasound can be used also with other minimally invasive treatment therapies such as radiofrequency ablation. So there are several different ones that are available. It can be used as a second look study for an MRI or magnetic resonance imaging or MBI, molecular breast imaging identified mass. We'll talk more about those specific tools next week, but suffice it to say that these are great tools and they're very sensitive. Sorry, I'm eating my hair. They're very sensitive. And when lesions are found, a second look ultrasound can better identify what's going on. Now, if necessary, at that point, an ultrasound guided biopsy can be done, which is often much more straightforward than a biopsy with MBI or MRI. And ultrasound guided biopsies are also less costly, they're faster, and again, they're more comfortable. If, however, there's no correlate on ultrasound of a lesion found on these other modalities, the lesion should not be dismissed. It should be reevaluated, and at that point, the patient may still need an MRI or an MBI guided biopsy. Now, in some cases, ultrasound can be used as a screening tool. So we're still talking about indications for ultrasound. And in some cases, in fact, it can be used as a screening tool. And although mammography is the gold standard for breast screening tools, and please keep in mind, mammography is the only imaging study shown to reduce mortality or breast cancer-related death, women with dense breasts cannot be as thoroughly imaged with mammography. So in those cases, an ultrasound can be used as an adjunct or in addition to mammography to better image the issues. Because breast ultrasound is not limited by breast density. Now, it's important to remember a few variables here when we're discussing screening by ultrasound. So first of all, breast calcifications or microcalcifications are not readily visualized by ultrasound. So a mammogram should still be done even if an ultrasound will be used as a screening tool. So that, again, ultrasound is an adjunct or an added imaging study, not the sole imaging study. And there's no question that ultrasound can identify more false positives. So in other words, an abnormality may be identified on ultrasound that leads to a biopsy that comes back as normal tissue. That's a false positive, and that can certainly happen on sonography. Another variable is that handheld breast ultrasound is operator dependent. So it's based on the examiner's experience and their ability to identify, acquire images, and interpret those images as lesions in the breast. For instance, an inexperienced sonographer may mistake a normal tissue for a mass, or vice versa. So there's always that caveat that needs to be said. Now, automated breast ultrasound that I discussed before may improve efficiency and efficacy of this modality. The problem is it's not available everywhere. Now, there's no question that advancements are underway to make ultrasound better and better and to make automated breast ultrasound more widely available.